Good morning. My name is Tim Byers. I'm the Associate Dean for Public Health Practice at the Colorado School of Public Health. And on behalf of the School of Public Health, I want to welcome you to this symposium on oil and gas development, public health, and environmental issues. This is a symposium on science, and so we're going to focus today on what we know and what we don't know about health effects of oil and gas development activity. This is not a session on many of the background issues that are behind the scientific issues. This is not, for instance, a symposium on the political science of oil and gas development. And there's plenty of that going on in the background. Nor is this a symposium on economic issues. Nor is it a symposium on ethical issues. But having said that, having acknowledged that in the background there are political and economic and ethical issues that are important, we don't want to trivialize those. Nonetheless, we're going to try to set those aside as much as we can and have a day talking about the scientific issues around what we know and what we don't about health effects of oil and gas development. Now, I'm going to share something with you here at the outset that hopefully will be the last one you'll hear today. Oh, yeah. So turn off your phone ringers if you can, and I know you can. For those of you who are guests on the campus, welcome to the Anschutz Medical Campus. Those of us who are staff here today will be happy to help you with any particular problems or issues or special needs that you have, so just let us know. If you want to connect to the internet, there's an option called Guest, and when you select Guest, you'll be asked to accept some sort of a statement. I've accepted it freely for years, and nothing bad has happened to me, and I haven't read it yet. So feel free to use the Guest internet connection if you like. Throughout the day, the staff from the Center for Public Health Practice will be videotaping each of the presentations. Each of the presentations and each of the panel discussions will then be posted on publichealthpractice.org. The website is at the bottom of your agenda. By early next week, the videos should be up and ready to view if you want to see them again or if you want to share them with any colleagues who couldn't be here today. We will be asking and answering a lot of questions today. During the sessions, the panelists will ask questions of each other, but throughout the day, as you have questions, write them on the index cards. There's a pile of index cards on the table in the middle of this room. There's a pile at the registration desks. Jot down your questions, one question per card, and we'll collect those by just dropping them in the Tupperware boxes that are around. And in the afternoon session, then beginning at 2:20, we will ask and answer questions that you ask, where all the presenters will be up front. I was advised that there's a parking lot, the Kiowa lot, which is the one immediately next to this building, not the one across the street, but immediately next to it, that apparently has a 4-hour limit. But what we're told is if sometime at lunch you could go out and put $1 more in and then put that receipt on your dashboard, they'll allow you there to park all day. So with $1 more, you can ignore the 4-hour limit. If you have any problems or issues with parking, just be sure to email us at the Center for Public Health Practice and we can take care of it later. We will not be taking time to introduce fully all the speakers today. The speaker bios are in your handout, and as you'll see, we have a very distinguished and multidisciplinary group of speakers today. So please learn more about the speakers by looking there. I want to thank the Symposium Planning Committee listed here. We have representatives from academia, from public health agencies, federal, state, and local, from advocacy organizations, and from the oil and gas industry. And this was a committee that worked really well together with this focus on science first and making sure we had the best presenters to summarize the scientific evidence for you today. So with that, again, welcome to the Anschutz Medical Campus, and on behalf of the School of Public Health, I'm delighted you're here.